Hi, thank you so much for being here. My name is Lydia Buzaalirwa. I work at AIDS Healthcare Foundation as the Senior Director for Medical Logistics and Medical Management. I'm passionate about public health, women in leadership, adolescent girls, and emerging diseases. I present to you a project, Career and Leadership Exposure for Adolescent Girls, aimed at improving schooling, reduction of teenage pregnancies, STI, and HIV as part of my WomenLift health journey. A bit of background to this project. According to a 2021 UNICEF report, adolescent girls in Eastern and Southern Africa have a high adolescent birth rate that stands at 92 births per 1,000 girls. This is double the global rate. At AIDS Healthcare Foundation, we have projects for adolescent girls and young women, such as the Girls Act program, which uses a peer support and knowledge access approach. These girls, however, are not beneficiaries of other ongoing projects, such as DREAMS. Now, a study looking at 2019 to 2022 data highlighted some risk factors for adolescent and teenage pregnancies, such as age 18 and 19 years, which almost tripled the risk, low educational status, so no formal education, that doubled the risk. Well, coming from a poor social background, doubled the risk, and then having a male-headed household had a protective effect. Now, a bit of the problem statement. During the COVID-19 pandemic, we experienced a very high number of teenage pregnancies, which could be attributed to school closures. Now, again, looking at some of the UNAIDS data, we see that 82% of new HIV infections are among young women, especially in sub-Saharan Africa. And then these girls also, when they become sick or pregnant, they suffer some psychosocial, physical, and social consequences, eventually leading them to drop out of school. In addition to this, some of the girls have limited access to knowledge and information regarding sexual and reproductive health services. This project intends to empower young women and girls aged 13 to 22 years residing in HF implementation areas in order to improve their likelihood of staying in school, and then HIV and STI free. The three pillars are mentorship and role modeling, access to skilling and employment opportunities, as well as access to sexual reproductive health services, including HIV. Now, our theory of change states that increasing longevity in school stay for the adolescent girls and young women will reduce the risk of early pregnancy, STI, including HIV. Our motto is that informed, empowered, and skilled girls are less vulnerable. Our project implementation will include activities such as conducting, and some of these have been done, conducting a needs assessment, developing tools and guidelines, SOPs for mentorship, mentor and mentee selection, then training of peers, as well as training of role models and trainers. Some of the outputs we intend to experience to see as a result of this project include having more girls participate in the Girls Act, a reduction in unwanted and teenage pregnancies, reduction of prevalence in school exit, and then reduced diagnosis of STI. I'm grateful to WomenLift Health, and some of the skills I have learned and been able to use include embracing and using my personal experiences to create a positive impact for others, being able to utilize my voice to mobilize resources and create a positive influence on how adolescent girls and young women programs are implemented in HF. I've also developed and broadened my professional network beyond women in the medical profession. What do we intend to do next? We intend to pre-test the developed documents during the next Girls Act meetings. We want to identify and train HF staff and peers that are involved in implementing these Girls Act programs, engage individuals, companies to avail mentors, as well as role models and internship placements. I want to also liaise internally to increase access to HIV and STI services. I will use leadership skills such as ally and amplify, developing others, using my leadership influence, as well as inspire action. Thank you very much.